Hi, y'all. So like Richard said, we're going to look at some of the data from the state of the child. It is in your booklets if you're at home. It's on our website. I think I made this presentation match up with the booklet, but no promises. It might go rogue and bring in another topic at some point. And so we're going to go over the data. I'm going to try and make it as fun as possible and also not feel like I am throwing a bunch of numbers at your face and then running off stage. So we will see how that goes. But before I get started, I wanted to ask our media team, this thing that looks like a clicker, is it a clicker? Okay, cool, thank you. And so, how does it click? Maybe? Oh, the big button, that would do it. Okay, so with the state of the child, we kind of broke it into a few groups. So in the circle are those main headers, and then on the other side are going to be all of the topics that we address. So we did demographics, special topics, education, economics, health, and youth justice. There's a lot in the report. I'm going to try and cover as much as possible, but if anything interests you, definitely read it, look it up, ask me any questions. And so this state of the child was a little bit different than we've done in the past. Due to the pandemic, there were some data challenges and challenges with collecting data. And so we kind of had to go find other sources. We typically use the Census Bureau, and they're going to be releasing their data. It was a little bit delayed, so it should come out at the end of this month. And so because of that, some of the sample sizes were smaller, so we weren't always able to compare by race, ethnicity, different demographics. And then we also, because it was different data than we typically have relied upon, we weren't able to compare it to other years as often as we do. And so I think when we start talking about demographics and children, it is so important to understand kind of where we are as a state when we look at different indicators where we might talk about overrepresentation or underrepresentation. So here's a little chart of the current racial and ethnic breakdown for Tennessee children. And so as Tennessee's children become increasingly diverse, equitable access to economic opportunities, education, healthcare, and justice have to remain at the center of our system's policies and programs. And when we look at diversity, one area that we're seeing an increased level of diversity is in Tennessee children and immigrant families. So 1 in 8 Tennessee children are a part of an immigrant family, with the largest percentage coming from Latin America. And then 1 in 10 children in Tennessee speak a language other than English at home. And so when we're thinking about outreach to services, access to services, really taking into consideration some language barriers that might prevent people from accessing those services. And so in special topics, it's almost impossible to look at data this year and not talk about the impact of COVID. And so looking at this is a national chart. The blue line is the trend line of pediatric visits 3 to 5. For the typical year trend, and you can see that the orange line is the 2020 trend, and it was matching up pretty well until about the 6th week or so, and then that's when we saw, the 16th week, and that's when we saw the drop in well-child visits nationally. In Tennessee specifically, there was a 62% decline in pediatric visits from April 2020 compared to that month prior in March 2020, so we saw a sharp drop-off. And matching that was a drop-off in the Tennessee child vaccination rate. It was 39% lower in April 2020 than it was in April 2019. And well-child visits and immunizations are critical to supporting healthy childhood development. And so like Dr. Piercy said, a lot of those did come from just delay, and so we need to make sure that we get them back on track in that way. Additionally, when we look at the impact of COVID, we see that a lot of children were sent home, or parents had childcare disrupted. And when childcare was disrupted, over half of those parents who experienced those disruptions took unpaid leave or cut their work hours. We saw a large percentage of women leave the workforce, and all 3 of those have a direct impact on a family's economic situation. And so when we talk about economics, in September of 2021, 42% of Tennessee households had difficulty paying usual expenses, and that was actually a 12% increase from 2020. So we saw more families struggling financially in 2021 than in that year prior in 2020. Prior to the pandemic, nearly half of all Tennessee families were struggling financially. And in 2019, 1 in 4 Tennessee families were receiving financial assistance to help provide for their children. And then with COVID response, there was the child tax credit. In October, the child tax credit helped financially support 700 Tennessee families and ensure that over 1 million children had their needs met. 89% of low-income families used the child tax credit to provide for basic needs or education, and it pulled 1 in 7 Tennessee children out of poverty. And then when we look at housing, in August of 2021, 1 in 5 Tennessee households had little or no confidence in their ability to pay the next month's rent, and half of those households were facing foreclosure or eviction. And then about 150 or so thousand extremely low-income households are spending over half of their income on rent, mortgage, things of that nature. And then we know that third grade reading, math levels are a predictor of high school graduation and so on. And so we saw 1 in 4 students scored on track or mastered in math, 1 in 3 scored on track or mastered in reading and language, and 2 in 5 students scored on track or mastered in science. Over here we see the 65% of Tennessee 4th grade students rated below proficient, and we have it broken down by different demographics, with the largest demographic being students with disabilities or those eligible for free and reduced lunch had the lowest rates of reading proficiency in 4th grade. And then in the 2020 to 2021 school year, 1 in 4 districts met the state goal of 1 certified social worker for every 1,500 students. The National Association of Social Work recommends a ratio of 1 to 250. And then a little over 1 in 3 districts met the goal of 1 certified psychologist for every 1,000 students. And the National Association of School Psychologists recommends a ratio of 1 to 500. So we're seeing that students aren't getting the supports that they need. We're not meeting the ratios that we've set out for ourselves, and those are lower than the recommended ratios. And so when we look at infant and early childhood care, we focus on 3 things. We focus on it needs to be accessible, it needs to be affordable, and it needs to be high quality. So 48% of children in Tennessee live in a child care desert. That is an area where there are no child care spots, or there are 3 children for every 1 spot available. High quality child care is instrumental in supporting childhood development as well as Tennessee's workforce, but the costs of it put it out of reach for many Tennessee families, even those that have both parents in the workforce and need child care. The Department of Human Services defines affordable child care as 7% of a family's income. And by that standard, only 1 in 7 Tennessee families can afford child care. If it was capped at that 7%, the average family would save about $14,000. And currently, a minimum wage worker in Tennessee would need to work full-time from January to July, paying for nothing else but child care in order to afford child care. So the affordability is a huge issue, particularly for those in low-income employment situations. And then high quality, once they can afford care and find it, they struggle to find high quality care. Tennessee early childhood education can support the social and emotional skills while increasing school readiness, but only 1 in 3 child care providers in Tennessee are licensed by the Department of Human Services or Education, and even fewer than that, 1% have national accreditation. And so we see that we don't have that many that are accredited nationally, and that is an indicator of high quality. And then we have seen an increase in the number of students receiving Tennessee early intervention services. We do have a very low percentage of children from age 3 through 5 who are not in, or we have a low percentage in school. And so we know that that helps with school readiness and social and emotional behaviors. So that is a critical indicator. And then we also don't match our spending to the amount of children under 5 in Tennessee. And so children under 5 account for about 27% of all children in Tennessee, but we are only spending about 14% of our child funds on them. And those are that age group has the greatest return on investment. And then this was probably one of the more shocking areas when I was working on the state of the child, was just how much Tennessee is struggling with mental health and how much our teenagers are struggling with mental health. On this slide here, we have the Mental Health America ranking the states, and Tennessee is 40th out of 51 in youth mental health, and then 45th out of 51 in access to care. This graph here is a little bit small, I do know that, but the bars that you're seeing in orange, Vanderbilt Child Health Poll asked parents of kids age 6 through 7 if their child had been diagnosed with a mental health condition or disability. And so the percentage in orange are the parents who said yes, they have, and what disorder they were diagnosed with. And then, oh, I'm sorry, I got confused. The percentage in blue is that. So the percentage in blue are those who have been diagnosed. The percentage in orange are those who their child has not been diagnosed, but they have concerns that there might be an undiagnosed behavioral condition. And so with that, we saw that 21% of parents were concerned that their child had an undiagnosed behavioral health condition of anxiety specifically. And then Tennessee has a very high rate of teen suicidal ideation. A survey of Tennessee high school students showed 1 in 5 had seriously considered suicide, 1 in 7 had made a plan of how they would attempt suicide, and 1 in 10 actually did attempt suicide, and 1 in 25 that attempt resulted in injury, poisoning, or overdose that had to be treated by a health professional. And we see that was just, they were asking specifically about the last year. So that indicator was just within the last 12 months. Have you seriously considered attempting suicide? In the same survey, 1 in 10 reported attempting suicide. The highest risk factors were being female, Hispanic, or Latino, or a sophomore. Those were about 18% or so. Teen substance use is on the decline. Tennessee is lower than the national average, but there is an alarming increase in fatal overdoses, particularly attributed to fentanyl. It is involved in 80% of overdoses among Tennesseans 15 to 24. Overall health here, this slide got jumbled, but here's some just general indicators. More than 1 in 5 Tennessee children have special health care needs. And more than half of Tennessee's children with a behavioral or mental health condition did not receive any treatment or counseling. And then, despite the risks the flu presents to children under 2, in 2020, only half of children under 2 had received at least 1 dose, and less than 1 in 3 had received all recommended doses. Can I go back? I can. And so, then with the Vanderbilt Child Health Poll found that the number of uninsured children increased from 4 to 9%. This was mainly attributed to a loss of private insurance from loss of employment from the pandemic. Currently, in 2019, over 53,000 Tennessee children remained uninsured, even though they were eligible for TennCare Cover Kids. And so that's when we're thinking about that language access, accessibility, rural communities, things like that. And then in fall 2020, 1 in 5 parents who were enrolled in TennCare or Cover Kids reported a loss of coverage over the last 2 years, and more than a third had attributed that loss to a paperwork issue. Currently, Tennessee has 12-month eligibility, a continuous eligibility for Cover Kids, allowing children to remain in that coverage for 12 months after enrollment, despite any temporary fluctuations that might occur in a parent's income. Due to the COVID public health emergency, this eligibility has been extended to all Medicaid recipients, But once that state of emergency expires, children with TennCare will not have that coverage and protection, and they'll be more vulnerable to coverage gaps. And so to ensure coverage for all youth, Tennessee should implement 12-month continuous eligibility for TennCare children, particularly since lower income individuals are more vulnerable to temporary income fluctuations that might occur. Tennessee always struggles with children born at a low birth weight, about 9.2%. When we look at COVID-19 and pregnancy, there's still a lot of ongoing research and data, but we did see that during the statewide stay-at-home orders, the rate of preterm birth was lower than the previous 5 years, but although they were seeing fewer preterm births, the infants born during that time needed more respiratory assistance at birth. Data from across the US has found that people who have COVID while pregnant are at an increased risk of severe illness, preterm birth, and stillbirth. The rate of teen pregnancy and teen births has been cut in half over the last decade, and that's following a national trend. And then when we look at maternal mortality, there's two different types of categories that we use. We use pregnancy-associated and pregnancy-related. Pregnancy-associated is any death of a mother that occurs from pregnancy until a year after birth. Pregnancy-related is when that death can be attributed to being pregnant or having just given birth. And so 37% of all cases of maternal mortality were pregnancy-related and 53% were pregnancy-associated. That remaining percentage was undetermined. The leading cause of pregnancy-related deaths was cardiovascular or coronary conditions. And then for pregnancy-associated deaths, so that broader category, acute overdose was the leading cause of death. 1 in 6 pregnancy-associated deaths were classified as intentional and violent, with 3 out of 5 of those involving a firearm. Of all pregnancy-associated deaths, 2 out of 3 were covered by TennCare after birth. Of pregnancy-associated deaths, the most fatal time period is about 1.5 months to 12 months after death. That's when it's the deaths are more likely to occur. Previously, TennCare coverage expired for women 60 days after birth, so just 2 weeks into that most fatal time period was when women were losing coverage. And so the pregnancy-associated mortality ratio for a woman on TennCare was 2.5 times higher than that of private insurance. A new pilot program, which I think started this week, I think it was March 2nd, will extend those TennCare benefits to 12 months. As this program is implemented, we hope to see a reduction in maternal mortality, as 79% of these deaths in the maternal mortality report were found to be preventable. And then as we look at maternal mortality, especially in Tennessee, it's almost impossible to ignore the racial disparities. In Tennessee, Black women are at increased risk of health complications associated with pregnancy. In 2019, they comprised 32% of all pregnancy-associated deaths, but when you pull it out and look more specifically at pregnancy-related, so those are typically those health conditions or attributed to being pregnant, the disparity increases significantly. In 2017, there were 17.7 non-Hispanic white deaths per 100,000 births, compared to about 70 non-Hispanic Black women who died per 100,000 births. So Black women in Tennessee are 4 times more likely to die from a pregnancy-related cause than white women, and the most frequent causes of death are heart disease, preeclampsia and eclampsia, and embolism and infection. And so then we look at dental care. 1 in 4 Tennessee children did not receive preventative dental care. Tennessee falls below the average, but Tennessee does really well in community water fluoridation. 8 out of 9 Tennesseans are served by that, and that is beyond the national goal. So we exceed the national goal in that. And then ensuring access to dental care to women who are pregnant is critical to both their health and the baby's health. And that same pilot program that is extending TennCare benefits to 12 months is also extending TennCare coverage for dental care for pregnant women as well. In 2019, Tennessee had the highest rate of foster care instability in the nation, and that metric is defined as 3 or more placements within your first 12 months in care. More than 1 in 6 Tennessee girls reported experiencing physical dating violence within the last year. That's significantly higher than anywhere else in the nation and twice that of the national rate. The only indicator that was reported was physical dating violence, so we don't have any information on abuse, whether it be emotional or sexual abuse. This was just specifically asking about physical dating violence. Human trafficking, Tennessee has historically done really well in human trafficking. Our letter grade by Show Hope did drop to a D this year, but that is because they have upped the advanced legislative framework. We've seen a lot of bills in response to that, so I'd expect our letter grade to increase next year. But the most common form of sex trafficking in Tennessee was residence-based commercial, and the largest form of labor trafficking in Tennessee is traveling sales crews. Extension of foster care services, Tennessee received $7.4 million to support former foster youth, and also the work and education requirements were dropped to allow more students or more former foster youth to access these services, and they also extended the age range to 27. In mid-November, about 1,000 former foster youth had received a stimulus payment of $1,200, and 433 currently enrolled had received $1,000. And so data around youth justice is extremely challenging to find in Tennessee, and so as we present data around youth justice, it has to be taken a little bit into context of it is what we have available, and it can't paint a full picture of what we're seeing. And so when we look at it, just kind of we're always keeping that in mind. But this is a one-day snapshot of youth justice placements in Tennessee. I believe this was April 4th, 2020. So 48% were in a community placement, 19% were in a staff secure, or 18% were in a youth development center. And it's cut off, but the average cost to detain a child in a hardware secure facility is about $105,000 a year. I think that makes sense. You guys make me nervous, I'm sorry. But when we look at the Tennessee youth justice system, there are glaring racial disparities in the system. The data here is from the Administrative Office of the Courts, and it's from juvenile court referral data in 2020. There are 98 juvenile courts in Tennessee, and here we have the reporting of 78. So we're still missing about 20 courts. And as I mentioned, this data comes with challenges, but we can see that Tennessee follows a trend of racial and ethnic disparities in the youth justice system. And as the cases progress through more severe or intense punishment, the disparity increases, with Black children making up 71% of cases resulting in secure detention and making up 85% of cases being transferred to adult court, despite little change in offending behavior or anything like that. Other states have done studies. The disparity remains even when you control for other factors. Of the counties that were reporting this data, Black children were only 22% of the population. So although this data has to be taken in context, it is representative of a longstanding issue, both nationally and in Tennessee. But on a more positive note, I know we've seen a lot of challenges with Tennessee's data, but community involvement and educational attainment are at a 20-year high. So we had the number of young adults voting in midterm elections increased by 158% in 2014 and 2018, and the presidential election had the highest turnout in 20 years. So that is all I have for you. If you all have any questions, let me know. But thank you so much for letting me talk to you.